Good afternoon, everyone. This is Gary Paquin. Thank you for logging on early to our webinar. We're going to get started in just about 1 minute. We've got people still logging in from around the country. Very good turnout today. Appreciate your joining us on this launch of June, and hopefully it's a warm, nice day in your part of the world. Once again, thanks for joining us. And Tony, I think we're ready to go ahead and get started. So I'm going to turn my screen back on and be able to share it with everybody. Good afternoon, everyone. This is Gary Paquin. I'm one of the co-founders of iRemedy Healthcare, along with my brother Tony Paquin, who is the CEO of the company. We're going to share with you some very interesting and important information over the next 20 minutes about iRemedy, the mission, the work that we're doing. I think you'll be excited to hear about it. This recording is, we are recording this webinar, so if you'd like a copy of it in the future, we'll be able to get that to you. Also, if you have that control panel open on your screen from GoToMeeting, there's a little orange arrow. If you click on that little orange arrow, that will collapse that and take that off your screen so you don't have that in front of you. So once again, thank you very much for joining us. This again is Gary Paquin, and we're going to share with you now information about iRemedy. To begin with, just an introduction. iRemedy is an AI-driven technology, and our mission is to revolutionize the $130 billion medical supply industry. As we go through this presentation, I think you'll see a lot of the reasons why we're doing it, why it needs to be done. The medical supply chain in America is broken. We certainly witnessed that, all of us firsthand, during the pandemic, but it's been going on actually for many years. So it's an industry that's in desperate need of change. And by the way, this is something that affects each and every one of us. You know, access to healthcare and certainly medical supplies plays a very, very big role in that. So Tony, if you could say hello to everyone, and if you could further elaborate a little bit about iRemedy and as an introduction.
Absolutely. Good afternoon, everybody. Glad you could join us today. And we are going to take just about 20 or 30 minutes to walk through the iRemedy story. We're super excited about everything that's going on with the company. We are working on really doing some big changes in the medical supply business. You know, medical supply and medicine is something that affects everybody. So it's a very personal subject to all of you and all of us. There is a massive amount of work to be done to improve the healthcare system in America. It's about time that we actually modernized the system. Gary and I have been working on this for a number of years and very well connected in the hospital world and super excited about bringing some improvements. We began about 5 years ago to develop some artificial intelligence-based applications that could revolutionize the way that medical supplies are purchased and delivered in this country. And the reason we needed to do that was because there are massive shortages. You know, we all experienced it in the pandemic, but that, you know, was something that maybe every consumer experienced. But fact is, inside of healthcare, doctors and nurses and healthcare professionals, they've been living with shortages for a decade or more. So it's a common problem. And on top of that, just high cost. Everything costs way more than it should. And our mission is to attack those two problems of product shortages and high cost using state-of-the-art AI-based technology, for which we've already been issued a number of patents.
And I'll further mention, as probably many people on the call realize, the healthcare industry in the United States is in, as we said, desperate need of change. And also you've got companies who have been in this space, in some cases for well over 100 years, with very antiquated solutions, and they just lead into further exacerbating this massive problem that we have. And this has now been further escalated with all of the offshoring, and Tony will be able to talk to us about that a little bit later. All of the offshoring that's happened in the medical supply world over the last 30 or 40 years. Beginning with, and any good organization, and we believe we have a very revolutionary offering and an important mission, is the leadership that we have on the team, the people that have the vision, the knowledge, the experience to accomplish something that is truly transformative within the industry. Our company is headed up by my brother Tony, our CEO. Tony, like myself, is a lifelong technologist. Tony and I have started a number of different technology companies together very, very successfully. And Tony is a technologist at his heart. He's a noted healthcare consultant as well as an author. He's consulted with hundreds of hospital CEOs around the country for the last 15 or 20 years, government officials, both at the state level and at the national level. And Tony has written one book about healthcare, the retail healthcare revolution, and has a new exciting book coming out. As a matter of fact, it just got finished and it's moving into publication pretty soon on a medical supply chain and worldwide logistics. And it's a fascinating story. Maybe it doesn't sound like it from the title. We're working on different titles, by the way, but it is a fascinating story. I think something that people really enjoy reading. Tony was the founder and CEO of Agency One. That was a software company in the insurance industry. We sold that to CNA Insurance Company and then grew that to be the largest software company in the insurance industry. Tony is also the founder and CEO of Medinex. We did an IPO on the NASDAQ. It was kind of an early stage electronic medical record company. Jim Harding is a fascinating individual, one of the brightest people Tony and I have ever met. We've worked with a lot of tremendous individuals over the years. Jim is our CTO. Prior to joining us, Jim was VP of Technology at Amazon and actually built and launched the Amazon Marketplace. When he joined Bezos, at that time, Amazon was just an online bookstore. Bezos wanted to create a marketplace whereby you could sell literally hundreds of millions of products to hundreds of millions of people. So Jim created the technology to do that and actually has a patent for that. Prior to that, he started several companies and sold those to Jeff Bezos, Cardia and PhotoTrust. That's how we got to know him. Jim was also the founder and CTO of Multiscale. That was a healthcare technology company. That's where Tony and I met him quite a few years ago. And right out of college, Jim was founder of Seattle Computer Products. They were the creator of PC-DOS and actually sold that technology, licensed that technology to Bill Gates, which went on to, of course, great success. And Jim actually has a patent with Paul Allen on database technology while he was at Microsoft. So great guys leading the company from a technology standpoint and doing some pretty amazing things that we're going to share with you right now. Let me share with you just a little bit about the medical supply industry. It's an industry that's one of the largest vertical markets in the country. It's going to be over 163 billion by 2027, 138 north of 138 billion last year. So it's a rapidly going industry, has out of control prices, and we have supply chain problems and high cost of healthcare. So, this is a market that is ripe for change. And the growth in this market has been driven because of all these new medical devices, infection control measures, all of those things that we hear about and read about, every single day that seems to be top of news, that we're all very, witnessing in real time, if you will, shortage of drugs and everything else. That's the world of medical supply. And that's why we're making the changes that we are making. So as you can see from the graphics, it's a big industry, 240 billion plus. You've got over 4,000 hospitals, close to 10,000, probably over 10,000 surgery centers, and over 250,000 now physician offices. So there's a lot of, when you look down at the physician office level, at the surgery center level, There's a lot of massive growth out there. It's an underserved market that's looking for a smarter way to buy medical supplies. So, Tony, take us a little bit further now as we look at the healthcare supplies market. We could talk about some of the challenges in the market.
Well, first off, as you mentioned, it's a $100 billion market. It covers everything from consumers on up to hospitals and government agencies. For decades, though, there's been a pricing problem. Simplest way to describe it, we often say, is you take 100 doctors and you put them in a room and you ask them what they pay for a particular item, you'll get potentially 100 different answers. Just not fair. Very discretionary. One doctor in one city could pay more than a doctor in another city doing the same volume, doing the same treatment. Doesn't make sense. Well, built into that unfairness then is unnecessary margin. So people are distributors and dealers making money that they don't need to make. The other thing is there's this just product catalog shortfalls, lack of information about the supply chain, and then really that leads to lack of product. There's just, as I mentioned in the opening comments, there's just constantly shortages. If you go to Google today and you Google cancer drug shortages, no doubt there will be articles right now, I'm sure, there always are, drug shortages. So if you Google that, my guess is something will come up about some problem with some drug. And hey, if there's a shortage on a cancer drug and you've got cancer, this is a serious problem. It's a life and death problem. So this is ongoing. So the supply chain is frail and it breaks easily, and that's due to globalization. And that's what we all learned 2 or 3 years ago. Again, the industry's known it for 10 years. Consumers found out about it 2 or 3 years ago. Nothing that we need is made in America. It's made somewhere else. And so that's fine, potentially, but it's subject to problems. When things collapse, then we can't get the products that we need. It also means a lot of layers. You got manufacturers and you've got exporters and importers and brokers, distributors, dealers, GPOs, all taking a piece. So you have a lot of layers in the sales system, in the supply chain. That just simply means cost. That increases the cost. So whether that cost is paid by an insurance company or paid by a doctor or paid by a hospital or paid by Medicare or paid by the consumer, where ultimately all the cost ultimately goes, it is high cost, higher than it needs to be. That's the nature of the supply market today.
So when we talk about it being broken, the industry really is broken. Ordering medical supplies should be fast, it should be reliable, it should be easy. So that's what we look to create at iRemedy, the first company to do that. And we're going to speak now about the technology system that we're using, the AI that we created. We were creating AI back before it was so famous, a number of years ago. Tony and Jim got together and decided as to how we're going to attack this from a technology standpoint. But to reiterate the problem, you've got hidden costs, you've got global supply chain issues, and you've got a negative customer experience. That's the reality that we see in the world of medical supply today. And the players that have been in the space for decades, in some cases over a century, they're not responsive in this area. They're using antiquated technology, they're using old infrastructure, and a very fragile supply chain system. We saw what happened with that. And that includes, by the way, the US government that came to iRemedy looking for a solution. So Tony, talk to us a little bit about this artificial intelligence and what we're doing that's unique here.
Right, we've talked a lot about the problem, but what really matters is the solution. And what Jim and I realized as we began to take a look at the problem a couple of years ago, first off, we had this very complex supply chain problem with healthcare, because it's not like buying clothing or just other retail consumer products. You have this sort of managed supply chain, FDA, government regulated, life and death quality requirements. So it's very complicated, millions of products. And when Jim and I began to discuss it years ago, Jim pointed out, he says, technology has gotten to the point coming out of what Jim would call an artificial intelligence winter. In other words, a downtime when AI wasn't really working out, but there was breakthroughs starting about 3 to 5 years ago where we knew there'd be enough power to finally go solve this complex problem. And that's what started us on this journey. These things that we're looking at on the screen now are sort of the attributes of our technology. So first was that we developed this proprietary technology that can scale the marketplace. Yeah, a lot of buzzwords there. Sounds kind of routine, but it's huge. What we did was we effectively turned the internet into like a global database. So we can get all of the information we need nonstop around the world, 24 hours a day by developing digital agents that constantly go out and work the system, so to speak. The net result of that is that we create, and this is an aspirational, ongoing project. Our goal, simply stated, is to create the smartest and largest healthcare product catalog in the world. We refer to that as the universal health and medical product catalog. By that, our ultimate goal is to have every health and medical product in that catalog. Well, that's a big aspiration, but with the power of AI and the computing power, we can ultimately achieve that. Nobody else has ever done that. So that's what we're actively working on now. We certainly have north of 500,000 products, and we just grow on a daily basis. Then the next part of our technology is that we've developed these digital agents that essentially can duplicate human behavior. So they can learn what our supply chain operators do every day, our order takers, our order processors, our customer service people, and they can become what we refer to as digital doppelgangers. They can replicate that human behavior, working on behalf of that human to expand that person's reach into the market and leverage their own skill set. And so these digital agents that have been developed and are being developed at iRemedy allow us to do things like process orders from clients and place them with suppliers and track and report on the supply chain, the vulnerabilities of the supply chain, and to solve shortages. The net result is we're highly scalable. We don't need 1,000 employees because we can have 1,000 digital agents or 10,000 digital agents or 100,000 digital agents. So we actually have a very small staff. Roughly about 20 people, half of whom are technologists or a third or something like that. So we have a very small operating team because they use digital agents to expand their impact on the marketplace.
And use of technology, as Tony says, is everything. It's a force multiplier. This is patent protected, by the way. So within the world of medical supply, iRemedy has a dominant exclusive position. When you look at the millions of products that are being manufactured worldwide, over 90%, by the way, in Asia, it becomes very, very important to begin to manage this data. And that's what existing companies are not able to do. They're not able to manage literally the billions of pieces of data of products that are moving around the world. So we are in a global economy. We're in a global marketplace. There's a lot of challenges associated with that. That requires technology so that we don't go through the pain and suffering that we went through in this last couple of years. And everybody knows this is something that's in the news continually is the human workforce shortage. It's interesting. AI is coming out and everybody's thinking this is going to replace jobs, and it actually does exactly the opposite. It allows humans and allows us to then move into areas where we can function with a great deal more assistance with these automated agents, with this AI, if you will. So our patented AI technology, as Tony said, creates these doppelgangers, these agents that work on our behalf that do the manual work, so to speak, of automating what is a highly manual business. Because if you think about just the simple things of trying to maintain a catalog that's got 1 million products and 1 million images, and availability that's changing on a daily basis, pricing that changes on a daily basis. And that's where technology comes into play. So from a solution standpoint, our marketplace is set up so number one, it's transparent pricing. There's no hidden cost or fees, no surprises, just the best price on that product for all of our customers. Number two is to create an ordering experience that you would expect from an extremely easy to use system, something that's very, very elegant to use, simple, fast, secure, user friendly. Let's face it, the majority of people who are ordering supplies these days are millennials. And so, you've got to have an internet-based technology that they've been comfortable using for the last 20 years. And then a technology that we're constantly monitoring the supply. So using our technology to track inventories, availability, shipments, manufacturing 24/7, doing it automatically. We call it smarter supply saves lives. And that's really what iRemedy is all about. So we believe the time is now, and couldn't be more so than any other time. There's never been a better time to empower patients and healthcare providers with a service that's not only going to make their lives easier, but it's going to literally save lives. And that's what a supply chain, a medical supply chain should do. So when people invest in iRemedy, they're investing in the future of healthcare. And this is an industry that, as we said, and I think everybody on the call will agree, it's in desperate need of modernization. We need to bring the costs down. We make things more transparent. You need to get all those doctors in the same room. They're paying the same fair price and easy access to it. So Tony, this is a slide I'd like to have you cover. It talks about what makes iRemedy different from others, and then to look at what's happened in the world of healthcare and other technology companies in the last, goodness, over 150 years.
Well, in healthcare, the medical supply company's been around a long time. And these are companies we work with. So they're important, components, important players, if you will, in the domestic supply chain. McKesson, Medline, Cardinal, handful of others. McKesson, for example, was founded in the middle of the 19th century, just to give you a sense. And they are the dominant player in this market. So these companies are old and bureaucratic and established, but they're certainly not looking to disrupt or reinvent or modernize because they have a stake in the way things are established. iRemedy was really born at a time when the expectation is to do things in a new, modern, disruptive reinvention sort of approach to the market. Slide ago or so, Gary was talking about transparent pricing and an easy order process. And a lot of people would say, well, of course, that's what there should be. But that isn't what exists in the industry today. So, you cannot order your medical supplies for a surgery center like you can order groceries, online or daily purchases from Amazon. It doesn't work that way. It does in the sense that iRemedy is in the market. You can go to iRemedy and we're developing that kind of solution. But the rest of the industry is still sort of, based in the 70s and the 80s. A lot of sales reps out on the road driving around in cars, and some of these big companies still use fax machines. So we're more modern approach, but really what we're doing is we're attacking this highly complex problem using this AI-based technology to overwhelm the problem.
So our process, we want to create something that's extremely simple and easy to use. So browse through our catalog, over 500,000 products, and our technology is the source. If we don't have it, we can use our UHMPC and our AI technology to find it worldwide. And the interesting thing about the world of medical supplies, it's a very complex rules. It's a very regulated industry, as it should be, FDA regulations and drug regulations and so forth. So we operate within that world. So we're able to properly find the products, put them into the proper channels. And then with a simple click, you're purchasing the product. And then our technology then is set up to report, analyze, so forth. And we believe that there is a massive amount of opportunity and importance in that. We've been very successful. We've got over now, I think, over 15,000 customer reviews and ratings, over 10,000 customers. So 4.7 overall star rating system. So we're a consumer-facing B2B store doing some great things. We're rolling out some really exciting technology this summer. So, we are ready. The summary is we believe that the UHMPC, the Universal Health and Medical Products Catalog, is the largest and smartest medical products catalog on the internet. And that's extremely important, not only the future of our country, but also worldwide. We do have a highly proprietary marketplace technology that was developed by the creator of Amazon's technology. And Jim believes that this technology surpasses that. We've got an executive team with a successful track record of acquisitions and a NASDAQ IPO. We've done quite a few of them between Tony, Jim, and myself. Revenue that exceeded over 50 million in 2022. And we're able to scale and grow this company rapidly. Our goal right now is to take this company public. We are IPO ready. So we have a public auditor. We've got great banking team relationships. So we're positioning the company when the market's right as we head into the final part of 2023 and early 2024. We're ready. We're ready to take the next step for this company because we want to grow this to be a worldwide medical products distribution company that is the gold standard. And we know we can build a billion-dollar company. And I want to thank you very much, everybody, for joining. Once again, if you would like a copy of this presentation at the end of it, just shoot me a note. My name is Gary Paquin again. Email is simple. It's gary@iremedy.com. And if you have any questions, shoot those over to us. We'd be happy to answer those for you. But we've built this with a lot of great people. We've got about 100 doctors as investors. We've got a lot of very future thinking people with a mindset that is right. We're going to change the way that healthcare is delivered in America and medical supplies are delivered in America using this new technology. We'd love to have you on the team with us. Thanks, Tony. Thanks, everybody. Have a great launch to your summer wherever you are. Thanks very much. Bye-bye.
Thank you.